To the Zika threat, officials saying they expect more cases to pop up, all the while Florida Governor Rick Scott announcing the total number of people locally transmitted with Zika has more than tripled to 14 in the Sunshine State, to Dr. Nina Radcliffe. Dr. Radcliffe, here's the thing. We heard about it a few months ago, kind of told don't really worry about it. It's mosquito-borne. It's not sexually transmitted. It's mostly Brazil. We saw it coming up, hit Puerto Rico big. Now it's in Florida. People are getting worried. People are really afraid.
People are afraid, but I do want to point out that we've been anticipating this for some time. Even when there was snow on the ground, we said that we will likely see this happen in the United States as the mosquito population rises with the warmer months. And I do want to point out this is still considered a small cluster of cases and not widespread transmission. Even with the new 10 cases, they're all believed to be isolated within 1 square mile of each other.
But isn't that how something starts, though? I mean, the idea that it's every day we hear more and more people from this one isolated place. How fast does it take something to become from a 1 or 2 people or a small cluster to become an epidemic? It can happen pretty quickly, no?
It's a possibility, but you have to remember we have a very different living conditions in the United States, where we have a tried and true track record of controlling mosquito-borne illnesses such as dengue fever, chikungunya, and West Nile. We have a very different situation. In other countries such as Brazil, they don't have air conditioning. They don't have screens that can protect them. They're living with mosquitoes in their homes, biting them all day long. So we have a different situation. And I do want to point out, this is not something they're taking lightly. These officials in Florida have been working on this. They're going door to door. They are knocking on people's doors to ask them questions if they may have the disease. They're collecting samples voluntarily.
Isn't that one of the problems, though? People don't really know, though, right? I mean, aren't the symptoms relatively mild, or maybe you may have a slight fever? I mean, it's tough to know if you have it, isn't it?
Well, you bring up a perfect point. What happens is 80% of people have no symptoms, and that's where the problem is. If you don't have symptoms, you don't know you have it, and that you may spread it to somebody else. But anyone who has traveled or knows somebody who has traveled, you want to take proper precautions.
All right, so the world was afraid of Ebola. Ebola scared the heck out of us and moved our markets. I mean, it was a big deal. And I think the Zika has become a bigger deal since it's been discovered, if you will, that it can be transmitted through sexual contact. I mean, isn't that a game changer to a large degree?
Well, I want to point out contagious illnesses are always worrisome. And with Ebola, we have to remember, while everyone was panicked, the U.S. was a leader in fighting this. We helped eradicate it, and we've contained that. Again, with Zika, this is something that this is what the Centers for Disease Control and Prevention do. They've been talking about this for months, and there have been efforts underway. Back in February, the governor of Florida already established a Zika information hotline for people who live there and planning on travel. This is something we've been educating. What's important for the public to know is to stay vigilant, to be aware and be educated on what's going on.
Governor Rick Scott asking CDC, Center for Disease Control, for the emergency response team. Does that indicate to you that although he's staying calm or attempting to be calm on the outside, there's a greater sense of urgency behind the scenes?
Well, prevention involves doing the utmost when it comes to precautionary measures. And what this means is for people watching, what the emergency response is to augment what's already being done, which is to help with their investigation, going door to door, to help collect samples and to help with mosquito efforts. They already have money allocated. This emergency response will now release additional funding to augment it, to further do it and protect people.
All right, Dr. Radcliffe, thank you very much. Really appreciate it.